My name is Marcia Smith, and I did my internship for marriage and family studies at Behavioral Health of Denton, which is also known as UBH. About UBH of Denton. This is a psych hospital that patients come to whenever they're suicidal or homicidal or have drug issues, and then they are evaluated and sent to other programs. It's a mental health program, crisis stabilization program, co-occurring disorders program, and chemical dependency program. They have an adolescent center, a military program, an adult unit, and a day hospital outpatient services. I worked in the adolescent unit. Why I chose this internship? I was looking for an internship that was hands-on. Most of the programs wanted people on a master's degree level. I searched the internet for therapist internship bachelor degree, and I saw a position working at UBH. The advertisement or the job posting said, UBH of Denton is currently seeking bachelor's, master's level program therapist interns to be a part of our social services team at UBH Denton. We work with patients ages 13 and up with a variety of mental health and substance abuse issues. Our inpatient facility is open 24/7 and internship opportunities are available each day of the week. I was the only intern that I saw in the adolescent center when I was there, and his hours, Baki is the director, and his hours were 8 to 5. But I'm not sure in the other units what their hours are, so you may be able to get the hours that you like. I was able to get as many hours as I wanted during the week. So the position description also says, UBH Denton will provide students with opportunity to learn and practice skills in the areas of needs assessment, client engagement, clinical documentation, and making community referrals. Students will also have the opportunity to practice their clinical skills in face-to-face counseling sessions with clients in a strengths-based, client-centered setting. Students will receive weekly supervision with a licensed professional in their area of study. So I applied for this position, and I got an email saying to come on a certain day at a certain time, so I thought it was an interview. But when I showed up, there were a whole lot of other people at the exact same time, and they thought it was an interview too. But they took us all to a room with computers and tables, and they told us how things worked and asked if we were still interested. And we basically got to choose the hours that we wanted to work. And they set up an orientation pretty quickly so that we could get started. I was told when I started that I would get experience in all of the different units, but maybe because my internship was only 160 hours, I only got experience in the adolescent unit. Plus, they had a whole lot of people that were in the adult unit already. What were my responsibilities? Gather professional resources for the therapy binder. Gather professional resources for the nurses station treatment binder, gather information for the behavioral challenge binder, help with facilitation of psych education group, attend some of the process groups, and keep track of group numbers for the active treatment binder. Other responsibilities were do biopsychosocial evaluations with patients. That's where we ask them a whole lot of questions about their previous psychological disorders and substance abuse, and if they've been sexually abused in different ways, and just a whole bunch of questions like that. And then we supervise patients when they fill out CABAs, because they're only allowed to use markers, but when they fill out the CABAs, it's like a checklist of different things, and the computer reads it, and so they need to fill it out with a pen. So we just make sure they don't hurt themselves or try to keep the pens and stuff like that, because it is a psych hospital, and so we have to make sure that the environment stays safe so they can't do something harmful. And I also helped the therapist and director with whatever else they needed, like making copies and stuff like that. How did I benefit UBH? I help the therapists have good research available to help patients. I put together a binder for therapy and the nurses station. I made a binder with challenge packets with different subjects that the therapists could give to the patients to help them improve and work on specific things that they needed to work on. I helped therapists get things done so that they could concentrate on other things and not feel overwhelmed. How did UBH benefit me? I gained experience doing biopsychosocials and CABAs. I have experience gathering good research for teaching mental health. I have applied therapeutic principles to myself and know what areas I need to work on in improving myself. So I learned more about things that I've studied in school more in detail and some other things that I didn't study. I've learned a lot about therapy. I have a deeper understanding of how everyone's life, situation, and challenges are so unique. I have more empathy and love for every individual person I come in contact with now. So now I'm going to talk about important connections between my coursework and what I experienced during my internship, which was quite a bit of information. I'm glad I learned all the different concepts and ideas that I did in my education because it helped me learn what areas to look for things for the challenge packets and the treatment binders, and so I knew what kind of good information was already out there and how to find good resources and specific areas inside of a subject. Like, for instance, I knew how to look up stuff. I knew that patients needed to have better boundaries, and so I knew how to look up specific things to help them to understand how to have healthy boundaries. So, in one of my classes at BYU, we learned that sometimes the person acting out as the healthier one is having trouble with the dysfunction and is a cry for help. I saw this in at least one patient. Most of these patients come from very hard backgrounds, and they're doing the best that they know how to deal with things, and they need to learn better coping skills or what kind of boundaries they should be having and stuff like that. Another important connection was in one of my classes, we learned about turkeys, a story about turkeys learning how to fly, and then at the end of the lesson, they all walked home. So when I first heard this story, I thought they were ridiculous because if you learn how to fly, why would you just walk? But then throughout the internship, I started seeing things, and I saw that where I have done the same things because I wasn't on this right level to learn things. And I realized that we are ready to truly hear and learn things at different times in our lives. Sometimes we'll be trying to teach people and they just aren't ready to learn the material on the same level. In our classes, we learn that different philosophers have different ideas to what makes up of someone's behavior. Working at UBH, I observed children from many different types of families. I also have my own experiences that tell me people can be influenced by many factors. Nature and nurture influence everyone. I feel that we all have potential to improve and become like our Heavenly Father as long as we're here. And teaching people therapy and learning things, and even life coaches can help a whole lot by just presenting people with information so that they can know what kind of family they're having that's dysfunctional, because we are only able to see what we were raised around, and so that's comfortable and familiar to us, but we need to learn better ways. And knowing how to look up the information that I've learned at BYU-Idaho, I can see where we can find better resources to find better ways of thinking and behaving. And I really like the communication and learned a lot from my personal life from that. So would I recommend this site and experience to other people or other students? There are positive and negatives to it, so it would depend on what you're looking for. The positives, I got the hours I wanted, the orientation was set up quickly, the director is nice and helpful, the therapists are nice, I learned a lot. It would be very beneficial on a master's degree level. The negatives, having to use a key for all the doors. The group rooms are cold, but the last day I worked it was too hot. There is a big risk to being exposed to diseases. There is a lot of foul language, and you are limited on what you can do on a bachelor level. Who should you contact to arrange an internship similar to this? Baki Martin is the Director of Adolescent Services, and his number is 940-320-8123. Thank you.